so here we are, 3 months.
Okay.
It's been a minute, yeah.
Yeah.
3 months post-op.
Yep.
You're starting to feel like your face is kind of back to normal in terms of the way that it feels to you.
Yes.
Sensations coming back.
Yeah, I have a little bit of numbing still
Just right in
here.
front there?
Yeah. Other than that, yeah, I feel great.
Okay, good. And you're liking your results? You feel
Yes. I'm so happy I did this.
like good. Yeah, I mean, you know, when I look at your face now, and I remember the way they were before, and I'll show you photos in just a second, but I see the areas where we talked about where there were a lot of lines laterally, just from a little excess skin that had accumulated. There's also a lot of heaviness in your face because the skin was kind of like hanging down, but it was also kind of, there's a lot of tension in your face. And so we released all that. Your cheeks are back, you know, you've got your kind of nice full cheeks that we were looking at and that we had seen before surgery. Other parts of your face feel like they've been rebalanced and kind of harmonized. The neck is very improved. And yeah, everything's looking good. Your incisions are healing well. Overall, your skin looks amazing.
Yeah, I'm really happy with the results of my skin as well.
Oh yeah, it's a big win.
Huge.
Yeah. So, so I'm gonna show you some photos for the 3-month follow-up, okay? And we'll kind of go from there.
Oh wow.
Before and after.
Wow.
Yeah.
Oh my gosh.
So
that's
big
huge.
change right here underneath where there's that heaviness. Now you've got a shadow.
That looked like I'm like much older. Right
well,
there.
you were.
Right.
We put you in the time machine. We went back in time. Now you're younger. Yeah.
Oh my
so
gosh.
so one important thing. Your face here is square and heavy because the skin is kind of hanging down. There's excess skin here laterally. Now you've got more of that heart-shaped look to you. You can see the edge of your mandible because we've elevated the position of the fat pads and things back where they belong. And we've released the heaviness from beneath your neckline. That shadow that we see is because you've got a new neckline, which is much improved. The cheeks are in better position. The skin is improved. We got rid of all the reds and browns. You remember you had all these little reds and browns everywhere, and this is why we always do a great laser afterwards to give you this complexion, which is just ridiculous. You look like you're 30 or something. Now, this is a nice lateral shot. The neck, right? It's the neck for me. So now you've got, before you had just regular kind of skin without any convexity here, now you've got your jawline. You've got that nice deep shadow that people see, and that's what people look for when they look at it for a good jawline. And we also were able to make the ear look good, no issues with the lobe. Skin looks good, cheek position is excellent. Here's the lateral shot. See that?
Wow.
The lateral shot doesn't lie. That's where we see the neck.
Not.
Yeah, that's where we see the neck improvements. Like you were talking earlier about how you're still a little swollen. There's some areas you're still massaging. That's what you're seeing right there. Those are going to get better with time. 3 months, we're at the point, like I said, where all the lymphatics are now healing. And now all that swelling can go down permanently because the lymphatics have kind of done what they need to do. This heaviness that you saw right here is all gone. The extra lines are gone. The cheek has been moved up. All the excess skin has been removed.
Wow.
3/4 shot. There you go. Another wow, because you can get this deep neckline, which, you know, that's the hardest thing.
My eyes too.
Yeah, improvements in the eyes, of course, from all things that we did, like, you know, getting rid of the extra that was above and creating a nice even contour with fullness.
Yeah.
You don't want to look, a lot of people remove too much fat here and then they look hollow and like full, and your brows look perfect. There's a good distribution of the fat. We redistributed the fat laterally over the top, which maintains that fullness that you see with youth. Within you can't even see the incision, of course, but you know, you see how that transition between the lateral eye and the brow is perfect right there. That's good. And then you're still going to want to do some Botox to improve the wrinkles here. You know, over time those things continue, but again, lateral shots don't lie.
Right there.
So I guess we're 3 months out. It's, like I said, it's still early because you're at the point where I say you're ready for high definition photography or for a wedding. People see you on the street, they don't know that you had surgery, they say, wow, you look really good. What are the comments that people are telling you?
I mean, it's amazing. A lot of people think I've lost weight, and I've lost a little bit, but not a lot. But they can't figure it out.
Yeah.
And I haven't really shared, but my 2 girlfriends that I shared with, they're like, I knew there was something wrong with you, different with you. Because I didn't tell them prior, and they were like, wow.
Yeah.
So,
well, I think the improvements are there. You know, obviously we're not, you know, you don't look different. You just look a better version of yourself, which is the key. I love it when patients tell me, no one can really tell, but everyone keeps telling me I look good, or I look, you know, like I lose weight, or you're more well rested, because that's what we're going for. And and then when I pull up the photos and patients say, oh my God, I can't believe that's like that's pure gold for me. So,
Yeah. Well,
what questions do you have for me?
I'm really happy with
Okay.
the results.
Great.
And I'm really happy that I found you and then I came here. And,
Me too.
how long
will it last? Great question. So I usually say you age at the same rate.
Okay.
So what that means is, like, say we took off, like, how many years do you think we took off on your face?
Oh my gosh, 15.
Okay, yeah, so I'd probably agree 10 to 15, and I think that's usually the average for my facelift. And then I tell patients, in the next 10 to 15 years, you're gonna kind of head in that same direction.
Okay.
There are 3 critical things we can do to reduce the rate of aging and to help prevent it. And those are things that we should definitely do.
Okay.
Every time I do a facial rejuvenation consult, I talk about 3 categories of my practice. Reversal, which is surgery, intervention, which is like injectables and devices, and then prevention. Prevention is the 3 things.
Okay.
Sunscreen.
I've been diligent.
Good. Oral collagen. Oral collagen supplementation. Remember we had you have the Juven, but
Yes.
we're going to switch to something like Vital Proteins or something like that.
Right,
Or Heal
right.
Fast has a product that's really good.
Okay.
The last is topical retin-A, topical retinoic acid, which I'll write you a prescription for if you don't have.
Okay.
That helps to reduce the fine lines and wrinkles, but also to improve turnover of your skin and collagen production.
Okay.
So those 3 things have all been scientifically proven to make a difference in terms of aging to reduce its rate.
Okay.
And then at 3 to 5 years from today, that will be the time to do a radiofrequency microneedling treatment with something like Morpheus 8 or Profound. Those are the devices that we use here. That would help to stimulate collagen deposition in the skin and to tighten the skin.
Okay.
And that way you can kind of preserve your result even further.
Okay.
That is key. That's key because at this age, your body stops producing collagen at the rate that it was, and you lose collagen at about 1% per year.
Okay.
It's cumulative. So if you think about it over time, that's a lot.
Right.
So now we're going to focus going forward on maintaining the collagen that you've got and maintaining your result. And that'll probably be every 3 to 5 years, a radiofrequency microneedling or potentially a laser. Also, I would definitely do another laser in 2 years
Okay.
because of the different skin issues that you have.
Yeah, I'm feeling that my skin's clearing up.
It's looking a lot better, and it
Yeah.
will continue to get better. We'll keep you on some other products to improve that even more.
Okay.
But the different little red spots that you have, we want to get you with another laser in 2 years because those can become precancerous lesions.
Okay.
So if we treat you, it will help prevent skin cancer.
And then, so even the laser that you did after surgery,
Not as intense as the one that the one we're going to do going forward will not be as intense as the one that you had after surgery.
Oh, okay.
A little different.
So you're recommending that I don't need to do that anymore?
Oh, no,
Or
it's
not,
a different
I mean, not
version.
anymore. I just mean like I don't need to do a follow up with that.
Oh, no, I would
Okay.
say in like 2 years or
Oh,
so,
wow.
you would get another, laser and or radiofrequency microneedling. And the laser at that time would be slightly different. It would be a halo BBL. It wouldn't be as intense as the contour that you had in those other areas.
Okay.
But of course, we'll wait and see. Now, if you have a lot of brown spots after the summer or red spots that pop up in the next year or so, just come in and we can do it. But most patients are like every 2 to 3 years.
Oh, that's good to know.
Yeah, they're not like, it's not that quick that you're going to put that stuff back on.
Right.
Especially if you're using the sunscreen,
I am.
retinoic
I'm
acid.
using
and
that
collagen.
what was the brand of
Elastin, Hydrogen.
I would love it.
Yeah, because you don't have to put on any foundation.
No.
Yeah, I use it too. People make fun. They're like, "Is that makeup?" I say, "No, it's
Really?
okay." Nobody
It
makes
is
fun. Nobody knows.
so nice the way it feels.
It's good. It's
It is.
creamy. It's smooth, and it's also the material itself is basically a metal. It's zinc oxide, so you don't have to worry about reapplying it as often because it doesn't get broken down by the ultraviolet radiation. So the other ones that are made of the tabas and the ulas, all those fancy words with lots of vowels in them,
Right.
those ones break down when the radiation hits them, and they also cause irritation and inflammation. This is basically a metal that captures the light from the sun and doesn't cause as much irritation and doesn't break down.
It's funny because today was the first day I wore a foundation in a long time, just
Great.
because I was coming to see you. But I
That product is
honestly,
great.
I
It's
really,
better
really
cosmetic
is.
grade pigment than like MAC Cosmetics. It's better than many of the cosmetic brands you buy in the store,
Yeah.
and it's cheaper, and it's sunscreen. So
And it's sunscreen.
yeah, that's the best
No,
part.
I love it.
Yeah, I love it too.
I actually use all of it now.
Good.
I ordered a trial size of
Good.
products, and I love them all.
Okay, I'll let them know. Maybe next time you come, we'll get you a little extra. We'll get you one. So the next time you're going to come back is going to be the 6-month time point.
Okay.
At that point, we're going to be looking at things, see how you're healing, adjusting things if needed.
Okay.
You know, you can't really get away from me for the first year. So it's 6 months and then a year. And at that point also, if you need, we can touch up talks, we can touch up other things like that.
Okay. Yeah, I probably will need some touch up.
Yeah.
When I come back.
Yeah. Okay. What other questions do you have for me? Not many.
Not many. I'm good. I'm good.
Okay,
I'm
good.
really happy.
Well, you got my number too.
I
We can
do.
always chat. So.
Yeah.
All right. Great.
Great.